Obama's health care plan. At Newport News in October 2008, Obama said the following.
In some cases, it may be that a corporate CEO is getting too good a deal. But what if you're a line worker making a good American car like the Cadillac? What if you're one of the steel workers who are working right here in Newport News? And you've given up wage increases in exchange for better health care. Well, Senator McCain believes you should pay higher taxes too. The bottom line, the better your health care plan, the harder you fought for your good benefits, the higher the taxes you'll pay. You see, Senator McCain would pay for his plan, in part, by taxing your health care benefits for the first time in history. I want everybody to be clear about this. This tax would come out of your paycheck. So if you make $40,000 a year and you've got a health care plan that costs your employer $10,000, now instead of being taxed on $40,000, you're going to be taxed on $50,000. Your taxes go up under his plan.
The very plan Obama openly criticized, he is now trying to enact.
The very first promise I made on this campaign was that as president, I will sign a universal health care plan into law by the end of my first term in office.
But there are a variety of issues with President Obama's promise and his health care plan.
My plan begins by covering every American.
But how will funding for every American be provided when not all of America works?
The cost of this plan will not add to our deficit. The middle class will be rewarded with greater security, not higher taxes. And if we're able to slow the growth of health care costs by just a fraction of 1% each year, we will actually reduce the deficit by $4 trillion over the long term.
Consequence of us getting 30 million additional people health care. At the margins, that's going to increase our costs. We knew that. We didn't think that we were going to cover 30 million people for free.
Funding for this plan will be created by burdening Americans with more high taxes and using America's emergency funds. A 5.4% tax on adjusted gross income would be placed on Americans who as a couple earn over $1 million or singly earn over $500,000. How is it fair to make the wealthy responsible for providing health care for everyone in America, working or not? This plan makes a 20-year-old who only costs $800 a year in health care costs to pay $2,500, and a 62-year-old man who costs $7,500 to pay a maximum of $5,000.
If you already have health insurance, the only thing that will change for you under this plan is the amount of money you will spend on premiums.
That will not be the only thing to change. There will be no longer freedom to choose what is in your plan. The government will now deem that. The government claims you will be able to keep the primary physician you like. But how long will that last for? Even so, the primary physician makes all medical decisions, and there are no longer any second opinions.
If you need to see a doctor, you will not have to wait in long lines for one.
But you will have to wait in long lines if you need surgery. Just look at the wait times for common surgical procedures in Canada. They're still waiting. The United States' attempt at universal health care will result in the same issues.
First, we will reduce costs for businesses and their workers.
This is not true. This plan includes an employer mandate where businesses must either pay their employee health insurance or pay into a government fund to cover the uninsured. There will also be various mandates imposed on small businesses that include filling out large amounts of paperwork and fees for not providing health care deemed fit by the government. Although the concept seems great, Obama's health care plan still has many issues that will eventually fail the American people.